Hello, everyone. Welcome back to Midwife Par Excellence. I am your registered midwife, Bernard. Now, listen, I know I have been away for too long, right? But I'm telling you, it was unavoidable, and I'm coming on today. First thing I want to do is to apologize for being away so long. With the pandemic and whatever is happening around us, trust me, I had to disappear for a while, but bear in mind, there has never been a day that you all have not been in my thoughts and my prayers, okay? Now, the home deliveries have increased. Our presence have increased in the field in terms of home visits, home deliveries, and such the like. All right, so hence my absence along with other personal issues. Now, I thank you all for being so patient, right? For sticking and staying and knowing that, listen, she will be back as soon as she can. Well, yes, guess what? I am back and I have no intention of staying away from you so long again. I apologize. Please, and I missed you so much. All right, now today, the topic I have chosen is a very common topic, however, oftentimes overlooked for the mere fact that it affects the men. Of course, we know the men don't like to go to the doctors, right? And so this condition would have been there brewing for a while until they have really gotten ill to the point that they have to visit the doctor. That's when they most times will know that something is wrong. All right, so today this lesson will take the form of a bulleting and explanation. All right, so I have my information here on paper and I will expound on every point that I would have read. All right, so the topic today is no other than prostate, the prostate gland, and prostate cancer. Now, what is a prostate gland? What is prostate cancer? All right, we shall find out. Let's see. Remember to listen, subscribe to your friend, tell a friend to tell a friend to tell a friend to tell a neighbor to tell somebody you don't know until everybody is on here. All right, remember to share, subscribe, click the notification button so you are aware when I make my posts. All right, today, so we said that the prostate is a gland found in men that is about the size of a chestnut or a walnut. All right, it sits below the urinary bladder, it is in front of the rectum, and it surrounds the urethra that takes urine and semen through the penis. It is located, as we had said before, in front of the rectum. It is about 1 ounce in weight and it is very soft and smooth to touch. Now, let us picture that. So here we have our bladder, right? Sitting on top. Then we have our prostate right here. The urethra runs through from the bladder to the external of the body, through the penis to the external of the body, through the prostate gland. So the prostate gland literally encircles the urethra. And just behind the prostate gland, we have our rectum. Now, they said it's soft to touch, so it's fairly soft. All right. Now, the function, and it has quite a few functions. And I'm telling you, gentlemen, this little gland right here is the man. All right. He has so many functions. I would encourage you all to take care of this little gland right here. Know what is happening with this little gland right here and act accordingly with this little gland right here so the little gland can remain healthy and okay. All right. It secretes a thin alkaline fluid that makes up about 1/3 of semen. This fluid helps to make the semen thinner and more fluid, hence making the journey down the urethra during ejaculation and towards an egg much easier. So basically, the prostate gland secretes the fluid that makes the semen, which is made up of other constituents from other areas of other parts of the male system, to make that semen. So the prostate gland is what secretes that constituent of semen that helps to make it thinner and more fluid. During ejaculation, the prostate contracts and squirts its fluid into the urethra, which is then mixed with others to create semen. Then it is expelled. So you see how important this little gland is. Now we continue. When the prostate contracts during ejaculation, it closes off the opening. Now listen to this one. It closes off the opening between the bladder and the urethra, pushing the semen through at top speed. Hence, it is almost impossible to ejaculate and urinate at the same time. Now we say almost impossible because there are situations, and I will expound on that a little later on. So listen, this prostate gland, upon ejaculation, it closes off that muscle right as you enter the bladder, so that no semen goes back. Instead, it goes forward through the urethra and external of the body as ejaculation. Man, this gland is something. It converts testosterone into another hormone that is essential for normal prostate functioning. And in the developing male, it is crucial for characteristics such as facial hair development. Now listen, this is the real deal. All right? Now we're going to talk about semen, also known as seminal fluid. It is a mucoid fluid. It contains sperms from the testes, secretions from the seminal vesicles, prostate gland, and the bulbourethral glands. So remember, when you hear of semen, the semen is made up of constituents from 4 areas: the prostate gland, the testicles, the secretion from the seminal vesicles, and the bulbourethral glands. All right? During ejaculation, semen is expelled. So basically, when you see semen coming out of the penis through the urethra, that entire process is called ejaculation. Wow. I bet you, trust me, it's something. When I was doing this research, I was in awe the entire time. The deeper I read, is the more in awe I was of this little gland here and its function and how essential it is to the male. All right? The reproductive male, that is. Now, once the prostate starts going bad, the bladder, which is an organ, as we said, it sits right on top of that prostate, will definitely be affected. And that's what happens most times when the clients will know that, listen, something is not right here, when that prostate starts going bad. All right, so look out for those danger signals. Once you as a male start having bladder issues that has to do with the bladder, you definitely want to get assessed. All right, now symptoms to look for to see if the bladder is having any issues. All right, and as I said before, it does not necessarily have to be because of the prostate. But once you start having these issues, you want to take a look or start looking into the prostate, the health of your prostate gland. All right. Now we're looking for pain while urinating or after ejaculation. So any form of pain after you're urinating, during or after urination, or after ejaculation, you're having the severe pain, that pain where you feel the need to take analgesia. Now you need to be assessed. All right. Pain in the penis, the scrotum, or the area between the scrotum and the anus. All right. So we're looking at this picture now. So that area between the scrotum and the anus, if you consistently have a pain right there, that is a red flag. All right. Blood in the urine. Now listen, we call that hematuria. Under no circumstance you should have blood in your urine. All right. Severe discomfort in the abdomen. So you are always okay, and then all of a sudden, gentlemen, you start having this cramping in the abdomen. Get it assessed. All right. Fevers, chills, or body aches, unexplainable. It's not something. Basically, once you note anything abnormal, we all know our bodies. Get to know your bodies, gentlemen. Once there is something that is abnormal, you want to get that assessed. All right. Trouble controlling your bladder. So you're unable to pass urine at will, and you're also unable to control your urine at will. Urine with abnormal odor. all right, or color. Any form of abnormalities, you want to get it assessed, gentlemen. Please, ladies, I implore you, many times we have to be the strong ones to get them to go to the doctor, because they will never go unless something is happening. I'm telling you. So come on, ladies, we need to encourage our men, and later on I will tell you what the age groups that we need to start looking into getting these men assessed properly. All right. Now, conditions. There are some conditions that can possibly affect the prostate gland, and right here I have the three main ones. So we have prostatitis, and this is an inflammation of the prostate gland. All right. So inflammation of the prostate gland, and this generally affects men under 50 years of age. Then we have enlarged prostate. The prostate enlarges, hence it restricts urine. Now, remember that we said that the urethra is encircled by the prostate gland. Now, as this gland gets bigger, you can understand that it's gonna tighten on this urethra, and very soon there'll be little or no urine coming through the urethra, because the prostate has gotten so enlarged that it restricts flow of the urine from the bladder to the urethra. All right, and that's what we're talking about. And this generally affects men over 50 years of age. Now, prostate cancer. It's a common form of cancer in men, and it says here even further that 1 in 9 male will be affected, or possibly will be affected. 9 men standing in front of me, and there are likely chance that one out of those 9 males will be affected by prostate cancer. Now listen, if this doesn't spark concern for you, it does for me, right? Now, the average age of diagnosis, and this goes back to the fact that these gentlemen are unwilling to go to the doctor until they have fallen ill. All right, and the average age of diagnosis of prostate cancer has been aged right around the age of 66 years old. Now listen, at 66, I would have hoped that it would have just been developing. But as I said before, and you will see further down where I'll be telling you the age, and you look at what age you really should start being assessed as to the age when diagnosis is taking place, right? You will understand that these gentlemen are not being assessed on time, and hence when they find out it has gotten so bad, most times we call it end stage, right? It has gotten so bad, and we really are disheartened by it when it could have been sorted out. All right. Now, there are some tests that are done to rule out or to confirm or to raise suspicion of prostate cancer. All right. First, we have the digital rectal examination, and the finger is inserted into the rectum. The prostate is felt for any lumps or enlarging. Now, listen, remember that we said that the prostate, so prostate is right here, and the rectum is sitting right behind. So if you do a visual, if you go into the rectum with your finger, the first organ you're going to feel is the prostate, and hence the reason why the digital rectal examination is done. So persons tend to ask, why are they, and that's the reason too why we have the men who are not going forward to get assessed with the rectal examination, because of the actual rectal of it. But listen, reason being using the rectum is because it is the closest to the prostate. So if there's any enlarging, anything at all abnormal, it is easier felt through the rectum. All right, gentlemen, so please, and it is a very easy, quick, and simple procedure. All right. Now, next we have the prostate specific antigen. And this blood test is done, and high levels shows a risk of prostate cancer. So, if when the blood test is done, there's a high amount of prostate specific antigen in that blood test, the suspicion would have already been raised to say, listen, something is going on with this gentleman's prostate, right? And hence further investigation will be done. All right. Now we have the prostate biopsy. If the doctor suspects prostate cancer, a piece is taken by inserting a needle through the rectum. Now this is normally assisted by a ultrasound, right? So a needle is used through the rectum by guidance from the ultrasound probe, right, for lighting and easier direction to the prostate, and a piece of the prostate is taken for testing, and we call that a prostate biopsy. All right, so if the digital rectal examination is done or the prostate specific antigen test is done and the doctor is not comfortable with those, then he will now call for a prostate biopsy. All right, prostate ultrasound, as we said, used to closely monitor the prostate, and it is also used to guide that needle to get a biopsy of the prostate. The next one, we have a prostate MRI. All right, and this is a more detailed microscopic view of the prostate to identify any possible cancerous cells. So if the digital rectal examination is done or the prostate specific antigen is done and the doctor is not comfortable, he will request a prostate biopsy or a prostate MRI for closer monitoring. All right, now symptoms of prostate cancer. So listen now, gentlemen, I think this part of the presentation you want to take closer look at. Now listen, trouble urinating, as I had said before. Once the prostate is having issues, your bladder most times will be affected. I cannot stress it more. All right, blood in the urine, blood in the semen upon ejaculation, weight loss. So you're losing this amount of weight, you're not on a diet, you're not trying to lose the weight, you're not stressing, and you just keep losing the weight. You want to get assessed. Erectile dysfunction, so all was well at home and then all of a sudden you have a problem getting an erection, or even if you do get an erection, it's not lasting as how it would. You want to start looking into being assessed. All right, now persons who are at risk for prostate cancer, these are some of the what would make you be more at risk of developing prostate cancer, or that 1 in 9 men who will develop prostate cancer. Older age, so as you increase, as you get older in age, you are more at risk. All right, gentlemen. Race, studies have shown that the blacks are more at risk, and they also show a more severe form of cancer, of prostate cancer. All right, they have a more aggressive form of the prostate cancer when they do. All right, so race has a lot to do with also family history. Remember I said that. Now I'm going to tell you that if you have an immediate family member, so if your father, your brother, or your son, you know that you're more at risk. So if you have a family history of prostate cancer, especially closely related males in your family, you know that you could be one out of those 9 men at risk. All right, and the last one I have here, obesity. Gentlemen, you want to keep your weight in check. All right, you want to keep your weight in check. Now, as with every cancer, prostate cancer, there is a grade that they have given it. All right, now the aggression of the cancer, they have given it a grade. So now they call it the Gleason score. There are many different ways that they use to test or to determine the aggression of prostate cancer, but the Gleason score is the one that is mainly used. And how this score works is that they start at a 2, which is the non-aggressive, and they go up to 10, which is the very aggressive prostate cancer. They're saying that most prostate cancers upon diagnosis range between 6 to 10. So listen, you realize what I'm talking about in terms of being quickly assessed as opposed to waiting until it has progressed. Now look, it says here 2 being non-aggressive and 10 being very aggressive. And upon diagnosis, most of the times the men are in and around the 66 age group. And they're saying that when they finally get to diagnose them, they're at a 6 to 10. That means they're way up in the aggression of the prostate cancer. And I am not comfortable with that at all. All right? If now you can determine if the cancer has spread. And of course, we would have told you that yes, the cancer can spread. Whichever cancer you have, wherever part of the body, it can metastasize. And that's what we call metastasize, means it has spread to other organs or other areas of the body. All right? Now, these tests are done. The doctor requests these tests to determine if it has started spreading or it is still remaining to where it would be in the prostate. So they request a bone scan. They request an ultrasound, as I said before. Right? A CT scan is done, an MRI is done. Right? These tests can also determine the stage of the cancer. And we said that cancer ranges from stage 1 to stage 4. Now, when they say prostate cancer, stage 1 prostate cancer means that it is still inside of the prostate gland. It has not gone anywhere. It is still where Mr. Prostate is. All right? Now, when it gets to stage 4, it has spread beyond and may have spread to other areas of the body. Now, I don't know. This is quite a mouthful. And as I said before, it's while doing this study, I realized, or I even got to understand, that this little prostate gland here is so important to the men. We normally just hear a person say, oh, the prostate, and they scoff it off and said, okay, whatever. But listen, it is very serious. Now we're moving on to the treatment of prostate cancer. Now, when your doctor would have just found out that you had the prostate cancer, the invasive treatment might not begin. They might just continue to do regular blood tests, regular rectal examinations, and prostate biopsies. Now, if it is noted that it is getting out of hand, it is getting worse, then these further treatments will be suggested. All right? So we have surgery, where they will remove the prostate, right? And you have your radical prostatectomy, and that's removal of the prostate and possibly other organs around. Now, radiation, so high-powered energy to kill the cancerous cells. All right? So as I said, these are some of the treatments that take place when you have found to have been diagnosed with prostate cancer. Now, they have freezing of the tissue, right? And we call that the cryotherapy. Now, what they do is that very cold gas is pumped into that prostate with the effort to freeze those cells. And that they are then thawed out, and that process is repeated in an effort to kill the cancerous cells. Wow. It says here also that the heating the prostate tissue, right? And it's the same process. Extreme heat is applied to the prostate gland with the hope of killing those prostate cancer cells. All right? Hormone therapy. So now they're saying they try to stop the body from producing testosterone. Now, testosterone, they say that the prostate cancer feeds on testosterone in order to keep itself alive. So basically, they try to give you hormone therapy to prevent that testosterone from being available to that prostate gland, so those cancerous cells don't spread or they don't thrive further. All right? Now, they do this by removing the testicles. So remember that the testosterone is produced in the testicle. So they remove the testicles, hence limited or no testosterone eventually. And hence they could either further treat with other treatment, or they totally get rid of the prostate cancer out of your body after successful treatments. All right? Chemotherapy. So this is where drugs are used to kill growing cells, right? And it can be given in the vein form or pill form or both, right? So drugs are given in pill form or via intravenous to kill these cancerous cells. Wow, I'm telling you. They also use immunotherapy, and they're using the immune system to fight the cancer. Now it says there that some of your cancer cells are taken, they are processed, then put back into your body to fight those cancerous cells, right? Drugs then help drugs that helps the immune system to identify cancer cells and attack them. Now it says here that the body's immune system may not attack the cancerous cells because the cancerous cells produce a protein. Now listen, the cancerous cells produce a protein that they encase themselves in, right? So our body system, our immune system does not detect the cancerous cells. So that's where they're going to use the immunotherapy now by either taking some of your immune cells from you, process them, put them back into your body, or they give you some drugs that will help our immune system to identify those cancerous cells, and in the hope that they will attack them and kill them or minimize the amount of cancerous cells in the prostate so other treatments can take place. Oh Lord, this is a lot. They also have targeted drug therapy, specific abnormalities that are present within the cancerous cells. These drugs block the abnormalities and they die. So the cancer cells themselves end up with abnormalities, and there are some specific drugs that they can put into your body to identify those weaknesses in the cancerous cells and kill them. Yes. Oh Lord. Oh. How does prostate cancer affect the body? And we have been talking about the bladder and metastasizing and all of this, but at the end of the day, when you have gotten your diagnosis from the doctor to say that you have prostate cancer, many of these things would have already started happening to you. Now, as we said, it metastasizes, so it spread to other areas of the body. So when you find out, you would have probably gotten really ill already, or the treatment, they would have to now be going aggressive treatment instead of starting with just a simple blood test and the antigen and those rectal exam. Now they have to be looking into immunotherapy, radiation, chemotherapy, and all those other treatments that I had identified before, right? Erectile dysfunction. Can you imagine? All was well and then all of a sudden you're sad. Urinary incontinence, as I said before. Alright? Now, how do you cope as a gentleman with finding out that you have prostate cancer? How do you cope? What do you do? You go to the doctor now, doctor tell you have prostate. What's next? What's happening? Alright, so these are some coping mechanisms I will share with you, with the hope that this will reach to somebody and help you in the event. Alright, so learn enough about prostate cancer. Alright, so you can make informed treatment decisions. So when you find out, you want to do enough reading. So when you are making a decision, you don't make a decision that you really didn't know anything about, or you would have wanted to know some more about. When you go back to the doctor, you want to go with information, action time now, right? Connect with other cancer persons, right, and survivors. So you want to go into a prostate cancer society. You want to find persons who are coping, who have survived, who are dealing with the situation. How did they manage? What did they do in terms of treatment and such the like? All right. You can go into art therapy, drawing, craft, making stuff, right? Dancing, exercise, meditation, music, spirituality. Tap into your spiritual side, all right? Talk about it and get your friends and your families involved. Now, there's one interesting fact here. And as I had said in the beginning, that semen can end up in the bladder. When it's time for ejaculation, there's a time when the muscle that is at the neck of the bladder, it doesn't tighten so well, and some of the semen might escape into the bladder, and that's what we call retrograde ejaculation. All right, so that is the only time you will find semen in the bladder. upon that time you will still have it coming out. So when you're passing your urine, you might say, oh, how do I have semen in my urine? Right? You might have had some in the urethra lingering around, or it would have escaped, unfortunately, via retrograde ejaculation into the bladder and remain there until it totally comes out eventually. All right? Now, all right, so continuing, right? I encourage you to urinate after having sexual intercourse, and this is in reducing your chance of having a urinary tract infection. All right? Just always ensure you go and pass some urine after you've had sexual intercourse. All right? Though not confirmed, studies, so they did a study between for some gentlemen who were between ages 40 to 49. And remember that we're not saying, as I said before, it's a study that I saw that was done, right? And these gentlemen stated that they ejaculated about 21 times for the month. And they showed that they were at a lower risk of developing prostate cancer than a gentleman who is not ejaculating so many times for the month. As we said, this is no basis for confirmation that, oh, if you ejaculate 21 times or more, you're at a lower risk. It's just a little survey that they did for some gentlemen who were ages 40 to 49. All right. Gentlemen have also expressed that they sleep a lot better after ejaculation. All right. Now, the body continuously produces sperms, right? So you will never run out of sperms. The average sperm takes about 74 days to fully mature. The body makes millions of sperms each day. So the question was asked for those gentlemen who are constantly ejaculating, having sexual intercourse, or however it is, they are constantly ejaculating, to say that they were concerned if they're going to have a low sperm count based on the amount of times that they're ejaculating. No. All right, your body is constantly making sperms, and so you will never run out. All right, so that's a point that I wanted to clear up. Now, I hope and I trust that this presentation would have enlightened you, let you realize how important this little prostate gland is, and it deserves the best treatment, the best monitoring, and the best assessment that the men can give. All right, so ladies, I encourage you to take your men to the doctor. Remember, I would have identified the ages and the persons who are at high risk. Those persons, you want to monitor them, have them monitored. All right. And for the other gentlemen who are at a medium and a low risk, or at no risk at all, you still need to note the age of assessment and get assessed. Right? It can only confirm or unconfirm things for you. But let it not be said that when you find out it is in the advanced stage, that little or no, or no, you're going to have to go to invasive treatment right away, when it could have been other way. All right. Now, at the end of this presentation, I will be putting some photos, all right, of the actual tests that are done, the digital rectal examination, the prostate biopsy, what the actual semen looks like, and other processes. All right. I thank you again for always being here. I encourage you to continue to make your requests. I've been getting the requests, yes, and I am preparing for your requests. All right. Remember to listen, to like, to comment, to share. Click the notification button so you are always aware when I make a post. All right. Now, I thank you again for being here. The support has been overwhelming, trust me. And when I began a few months ago, I made a promise. I said I will produce information once you request. All right. And once I've felt the need for a topic to be put out, I will go all the way to see how best I can thoroughly explain a topic for you. So I thank you again wholeheartedly. I am apologizing again for staying away so long, but I told you already, it will never happen again. All right. And so thank you again for being here. Enjoy the rest of your time. Share with someone and keep sharing. I am your registered midwife, Bernard, your midwife par excellence. I thank you. So, for the benefit of those gentlemen who have been asking if after they would have had a radical prostatectomy done, which is the removal of the prostate gland and also the seminal vesicle, if they'll be able to get their partner pregnant. Of course, not after the procedure. So before the procedure, you would have had to be doing sperm banking to get your in vitro and other processes done to get your partner pregnant after you would have done your procedure. Alright, so once you have done your procedure, there'll be no fluid coming from the prostate gland and also the seminal vesicle to make semen. Alright, so sperms will be made, however, it will be reabsorbed in the body after that. Alright, so you no longer have the capability of producing semen during ejaculation. Alright.